Hi everybody, welcome to the UEA's Nursing Podcast. Today I'm here with Sophie. Sophie has come to speak about studying at UEA with her diagnosis of ADHD. So welcome to the podcast and let's get going. So Sophie, I wonder if you could introduce yourself for us.
Hello, my name is Sophie. I am a newly qualified registered nurse in the Children's and Adolescents Mental Health Service, and I have ADHD and have been diagnosed for a few years now. And I'm here to talk about it.
Cool. All right. So let's start at the beginning. Mm-hmm. So you started your training in September 2020.
Yes.
Did you know you had ADHD when you started?
No, I did not. I had an inkling. It was actually, I had a friend who had ADHD combined type.
Okay.
And kept saying to me on multiple occasions, Sophie, are you sure you haven't got ADHD? Because I was basically the mirror image of them.
Okay.
And then I started noticing things in my studies, I couldn't pay attention, and I did some more research into it. And then that's when I started thinking, hang on, maybe it might be a bit of ADHD. So I had no idea when I started, absolutely no idea. So I tried to get the ball rolling. I put in a form with the doctors and they gave me all these fun assessments to do, really long paperwork, submitted it all back in. And then I was told, 3 years and then you'll hear back.
Okay.
So do you want me to keep going?
Yeah, just tell us what you did next.
So I thought, I don't have 3 years. I'm doing a uni degree now. I kind of need help now. I can't concentrate on anything. Sorry. So I found out that the UEA Specialist Learning Disability Team offered private treatment or diagnoses. So you still had to pay a certain amount. Unfortunately, I don't believe they do this anymore.
Okay.
But I went through this process and it was really quick. It was beautiful. It was painless. It probably took a couple months from start to finish. I had an assessment, a diagnosis, and then I got the paperwork back with my diagnoses. And this is, again, another molehill that I ran into. You then have to send this off to your GP to start medication or treatment. 3 years.
Okay.
So at this point, I decided I hadn't heard of this before, but I utilised my right to choose, which is where the NHS have private companies that have funding to treat NHS patients, depending on waiting lists and all the rest. So I said to the GP, can I utilise this, please? And next thing you know, I'm on medication within a couple of weeks. It worked really well, yeah.
Cool. Okay, that's interesting. So from your summary is from starting not having any inkling of it at all to challenging how you get diagnosed, but then a successful process to do so on medications for your final year, effectively.
Yeah, pretty much, yeah.
So let's go back to the start. Mm-hmm. Before you started on the uni program, how did you get on with studying? How was school? All that kind of stuff.
So bad. So my whole childhood, I was the stereotypical labelled naughty kid, always getting excluded, sent out the classroom, whatever have you. I had involvement from children's services myself because of my mental health, because it was so poor, because no one understood me. I didn't even understand myself. I still don't, to be honest with you. I'm still learning to live with the ADHD. And then in high school, this carried on. It's a constant. One thing they look for in ADHD is that this is constant from childhood to current day. Mm-hmm. And then obviously I started at uni and I wasn't getting my assignments done on time. I was having extension requests for every single assignment that I did. It was breaking down my relationships, my friendships. Everything was just going really bad. Some days I couldn't move. Some days I can't stop moving. There was no in between. So I was just really, really struggling and I needed support. I had several referrals open for adult mental health and things like that. So it was really, really difficult. And at several points, I wasn't sure if I was going to finish the degree because of this.
Yeah, that's interesting.
Yeah.
And so you had other diagnoses that weren't ADHD.
Yes.
That on reflection...
I'm not so sure, yes.
Okay.
So obviously being a female with underlying ADHD, undiagnosed ADHD, they gave me the label of, oh, it's just depression, it's mixed anxiety, it's this, it's that. Even bipolar was thrown in the mix at one point, and I'm thinking, oh, okay. So I was given all these labels, I was given medications and all the rest. And then I finally got my ADHD diagnosis, and I thought, hang on, I'm not so sure I agree with these other diagnoses anymore. They're not me, you know? So I still have these diagnoses on the system, but in my brain, they're not me. I think it all comes down at the end of the day to what was untreated ADHD.
Yeah.
Yeah.
Yeah. And in just having a diagnosis doesn't actually fix it. It's the management of it that makes a big difference.
Yeah, absolutely. Like, I'm not saying that you can't have both. You can absolutely have ADHD and depression and anxiety and all the rest. Absolutely. But in my case specifically, I believe it is just ADHD.
Yeah.
Yes.
And ADHD in girls is notoriously underdiagnosed and underspotted because people don't understand it.
No,
so
absolutely.
People go through high school without getting a diagnosis.
Yes. I was born in the 90s, and I think ADHD was only really taken seriously from maybe like 2010 or something onwards, let alone in females. So it was awful for me as a child. Awful.
Yeah. And then, so when you were saying, you were struggling when you in your uni before you got diagnosed, you were obviously coming into the same sessions as everyone else. You're in lecture theatres of 250 people, having to listen to someone for a few hours, seminars, being set away to do directed study and independent learning and all of that kind of stuff. Was it just completely overwhelming? Completely.
So seminars, I will be very honest, I slacked. I really slacked. I might be late, or I might leave early, or I wasn't taking notes. It's a wonder I've made it. But I wasn't getting any of the information I needed. And then when it came to summative season, I was just writing what I could and hoping for the best, because I wasn't taking anything in. And until obviously I managed to get the diagnoses and the support.
So if you were thinking about, if you imagine if you've got ADHD and you've got to write a big assignment of 2,500 words, that's a challenge in itself.
It would take me months.
And if you add into the mix the fact you haven't really engaged in their taught sessions beforehand,
exactly.
you've got two issues at once, haven't you? The lack of knowledge and the challenge of having the ADHD with writing it.
And I used to rely on something. I don't know if you've ever heard of an adrenaline pump before. When you leave everything to the last minute and then the panic kicks in and then your adrenaline starts going, and that would help me hyper-focus.
Yeah.
So that is what I was relying on while I was not having treatment. It was the adrenaline pump, and that's not healthy. You're leaving your assignments to the day before, and then you get depressed, and then things go wrong. You forget about your children, your dogs, the dishes. You don't do anything for 6 weeks. Do you know what I mean?
Yeah, it's not sustainable, really,
no.
is it? And it's certainly not sustainable. The longer the course goes on, when you get into the third year, you can't really achieve that in the same way.
Absolutely, no.
And how were you on placement?
Wasn't the best student, I will be honest. It's okay to not be an amazing student. Just I recognised my weaknesses though, and I did discuss them with whoever I was with. But before I was diagnosed, obviously I didn't discuss anything. I didn't know it. I thought I was just a bit of a bad student. But I'd find excuses to disappear, to go have lunch for an hour, or I might can I work from home today? So I'd still get the majority of my work done. Because as a student, it was depending on the placement, there wasn't a whole lot you could do in my experience anyway.
And you had the challenge of also doing your placements throughout COVID.
Yes.
And with restrictions and online stuff and all sorts of mix of stuff.
So my first year, we had a longer placement because of COVID. And it was in a community team. And obviously they were all working from home. So I thought, I'll work from home too. And next thing you know, I've done nothing. So I can admit it was awful. I know my weaknesses, and if you give me an inch, I'll take a mile.
Okay.
So it was really difficult, really, really difficult.
Okay. So you can see where your challenges are.
Yeah,
you can see where it would have been completely understandable to not have you sat here after 3 years having finished it.
Don't have a clue how I'm here right now.
Well, I think that we'll probably find out when we talk a bit more. But that diagnosis in the middle is probably
that has completely changed my life. Completely changed my life for the better.
So let's think about that diagnosis. So we've got the challenges of it, the traditional method taking years to get completed, the option of going private route, and you went for a private route through the university, which was different to how it's offered now, but it was an option. how were you actually feeling about it at the point when you thought, oh, I might have ADHD? Was that a positive thing to realise? Was it because you gave you answers, or was it a challenging thing to have a diagnosis of?
It was a bit of both, to be honest, because it was exciting because I was thinking, not that I can blame my behaviour on it, but it's an explanation. So that was a positive, but then it was also a negative because I thought I've then got this label attached to me for the rest of my life. And I also thought, I'm going to have reasonable adjustments everywhere I go. And, and I thought, you can't cure ADHD. I was like, it's all downhill from here. So, but then I also thought I can get treatment as well. So, it's a bit of both.
That label thing, did that make you think twice about getting a diagnosis? Slightly.
I thought, so my behaviour as it was without a label was, already quite poor. So I thought with that label, whilst it might be an excuse, I might get that stigma of naughty child, and then I thought it's something that I would have to disclose to workplaces, and I don't want them having that impression of me and all the rest. So it made me think twice. But at the end of the day, I'm really glad that I did go for it. Workplaces will not judge you for having ADHD.
Yeah.
If anything, it makes them more accommodating.
Yeah, good. Okay, so you had that apprehension about, should I go for it, should I not?
Yeah.
Went for it, went down that process. And can you remember when someone said, yeah, you've got ADHD?
I felt almost overjoyed in that moment. And it's really hard to explain why and what I was feeling. It was just, we were on a little Teams call because COVID, and they just said, I can confirm you have got combined type ADHD. And, the whole appointment, I'm sat there rocking on my chair like, ooh. But yeah, it was amazing. I was thinking, this is it. I can start working on progression. I can get my head down at uni, and then I can get on with my life. I can become a nurse. But then obviously it came around to the medication, and they said 3 years, and I thought, oh, we're back here again.
Yeah. So yeah, you have that high of a diagnosis, and then the next day it's still the same. I've just got a diagnosis.
Yeah, you've just got a label now.
So other than the medications, we'll talk about medications in a moment. Have you got other things that help you? Have you got other strategies that help you?
So I, prior to my diagnosis, I was a lover of lists. Still a lover of lists. I love highlighting things and stationery. I think everyone has a thing for stationery. So I would always write really long lists, decorate them, break them up into manageable little tasks. So my housework, for example, I would have a little list per room, and then on each room I'd have the jobs, and even really simple jobs like feed the dog, ticking that off made me feel so productive, and it really puts into perspective what you've managed to do for the day.
Yeah.
And now diagnosed, obviously, since I've done lots of research into ADHD, I have found loads of websites and resources that are so beneficial. One is an Instagram page called ADHD Doers.
Okay.
And I love that page. It's you pay what you want for the resources. It's not, it might say, £15, but it's not. And they give you things like books full of tips and hacks and tricks, little lists that you can make up and little doodles, and it's absolutely amazing.
Oh, okay.
So I really, really enjoy that. So honestly, there's so many resources online. You just got to look for them. You've just got to think, hang on, this could be it. Let's have a look. Let's give it a go. Because not everything works.
No, and just because you've got ADHD doesn't mean you're the same as the next person
exactly.
who's got it.
That's another thing. I never knew there was different types of ADHD. I always assumed naughty little boy in the classroom swinging off his chair. So I didn't realise there was so many different things to it. Yeah. Yeah,
there's lots that's not understood.
No,
even
absolutely.
by people who are reasonably well educated.
Yeah.
They still don't.
I mean, I've got it and I still don't 100% understand it.
So, fair enough.
Yeah.
But it takes a bit of time.
Yeah.
Okay, and what about the medications? So what? How did you get started on the medications, and how did they decide what you're having and what dose, and how's it monitored?
So when I obviously heard back, it's a 3-year wait for treatment, because I was thinking, I've skipped the 3-year and I hadn't. I went to the GP and I said, I'd like to use my right to choose, as I've said. And instead of going on and referring me to another provider, he said, there's medications that a GP can prescribe on something called an amber list, which is where they will need a second opinion before they can prescribe it, but it's within their powers to do. So he just went ahead and said, right, what kind of ADHD medication are you looking at taking? He spoke with me. He talked me through all of the different types. And to my understanding, there is 2 main types of medication. One of them is methylphenidate, which is what I'm currently taking daily. It's just a slow release tablet every morning. You can have the occasional day off if you feel like it, because it can reduce your appetite and things. But he took me through my options, and I said, yes, I would like to try methylphenidate, please. He went away. He got a second opinion. He came back, and he said, away you go. So we trialled it. Obviously, I had to have some physical observations done first and everything. Then after 3 months, he reviewed it, and we decided it was working.
Simple as that.
Simple, yeah.
And what differences did you notice in yourself at that point?
So many. So the day before I started medication, I'd taken on the task of basically redoing my whole garden.
Okay.
And it wasn't going very well. I'd started chopping down a bush, and then I'd walked off and done something else. And then the day I took it, I finished that garden within about 4 hours. I could concentrate and actually finish things instead of just jumping from one to the other. I was getting it done. It was amazing. And I also noticed one of the other things that has really changed my life since starting this, I'm not as angry anymore. So I used to have, if I tripped over my daughter's scooter, I'd throw it out the window,
Yeah.
And now I'm just like, oh, that hurt, never mind. And I can't even put into words how different it feels. I don't feel like I'm going to explode anymore. It's amazing. It's really amazing.
Were you apprehensive at all about starting medications, about side effects or changing your personality or anything like that?
So I was a little bit, yes, because my friend who originally thought, have you got ADHD, didn't like taking medication themselves because they felt it completely changed who they were.
Yeah.
So I was a little bit on the fence, but then it had gotten so bad in at that point in my life that I thought, what have I got to lose, really? I'll give it a go. I can always stop. Physical health-wise, I was a bit worried as well. Because some of the side effects are things like weight loss and headaches and stuff, but you get that with most medications, to be fair. But I was a bit worried, but then I thought, again, it's worth just trying and seeing how we do, because we can always stop if we need to. Nothing means I have to take, just because I've got ADHD doesn't mean I have to have treatment. So if it doesn't work, it doesn't work. And luckily for me, it did work.
Yeah, absolutely. That's good.
Yeah.
And so thinking about that now, there must be a time where it's still not perfect. So you've got diagnosed.
Yeah.
You've got your strategies in place.
Yeah.
You've got your resources you use online. You've got your medications. And then it's not perfect all the time, right?
Correct. Completely correct. So I still struggle with my concentration, of course. It's a million times better, but it will never be perfect. So I still have things where I need to do work there and then, and I might be like, oh, I'll do it later. But now I am actually able to do it later instead of just completely pushing it aside. Okay. So, but I do still have down days. Everyone has down days, Some days I won't take my medication. Some days I'll just want to stay in bed all day. I don't actually want to do what I scheduled myself to do. So the day before I might give myself a really comprehensive list of things to do the next day. And then the next day I don't want to do it. And that's okay. I just have to remind myself, have a day off. It's okay. The world's not going to stop. It's fine. Get what you need to do done. Make sure everyone's eaten and washed, and then just stop. So it's okay to not be okay.
Yeah, it's a really important message.
Yeah.
And then let's look at the flip of it. Because in a way, we've spent 20 minutes talking about the negative aspect. How do we fix this? How do we improve this?
Yes.
What are the positive things about having ADHD?
So definitely, obviously it depends on what type you have, but definitely my energy levels. I love how much energy I have. I can be awake from 6 a.m. to 12 o'clock at night. It's brilliant. I get so much done.
Yeah.
It gives me immense confidence. A lot of people have often told me that they're quite jealous of my confidence, but that works both ways. Sometimes I see it as a flaw as well, because I think, oh, just shut up, Sophie. But yeah, and it's also a little bit of an icebreaker, It probably shouldn't be, but it is.
Yeah, people find it interesting.
Yeah. I certainly do anyway.
And you said earlier on, you used the phrase hyperfocus. And
yes.
You talked about how that would be beneficial at some point.
Yes.
Do you find you have a hyperfocus? Does it change? Does it?
So some people are fortunate enough that they can control their hyperfocus.
Yeah.
I'm not one of those people. It comes at the most inconvenient time. So I do hyperfocus, but it will just be on something really strange. So I spent like 6 hours studying the Titanic for some reason, sort of thing, when I should be doing uni work, So, but I do love hyperfocus when I get it. That is a massive positive. You can do so much when you're hyperfocused.
Yeah, absolutely. It's just that driven, but you can't do all the other things that you might need to do.
You can't do anything you need to do, but you can do one thing.
Yeah.
And then you can actually feel like you've achieved something.
Yeah, absolutely.
Yeah.
So put it on your list and then tick it off at the end.
Yeah. But some people are fortunate enough to control that, but unfortunately I couldn't.
And that's the same thing, like you said, everyone's different with
Exactly.
it.
Exactly. Yeah. Everyone's different.
So another question I wanted to ask you is, we talked about how you were a bit apprehensive of getting that diagnosis and what it might mean for you. What was everyone else's response to it? So what did family think? What did lecturers and stuff say? Did you ever tell them? Did you need to? What about placements once you did get that diagnosis?
So I think it was quite obvious from a lecturer's point of view. I don't know if you'd agree, having lectured me,
I have.
That it's quite obvious that I have something going on.
We might have had an informed guess, perhaps.
No. So my mum, we're a very small, close little family. There's not a lot of us, and we're very close. And obviously my mum's been through the whole, childhood traumas and everything with me, and the depression and anxiety. And then I come up to her and start talking about this potential diagnosis with her. And obviously when you do the assessment, a form needs to be filled out by someone close to you. So I gave her a form. And my mum, unfortunately, wasn't that involved in this process. I think from an older generation sort of perspective, it's still not really a thing, if you know what I mean. So she wasn't really that involved. But I sat with her and I tried to explain it to her a bit more in depth. And I told her why it would help me and all the rest. And then I filled the form out with her. We did it together. And then I've got the diagnoses, got medicated and everything. And she's noticed how well I am progressing now. She has also said, I didn't think you'd graduate. And I was like, oh, thanks.
Thanks for the confidence. Yeah. Does she get that? She understands it's a thing. She realises that.
Yeah, she doesn't have as much insight into it as, well, probably as I would, as the person with it. But she understands the surface level. So she doesn't understand that ADHD can mean just lying on the sofa for a whole day doing nothing. Like she thinks it's just you're bouncing off the walls, Yeah. So she slightly gets it, but we'll get there.
Yeah. And what people often don't, especially if we're broadly generalising older generations who are, new diagnosis wasn't around at that point, commonly anyway, they don't realise that the hyperactivity is sometimes just in your head.
Yes, absolutely.
It doesn't have to be your body that's moving around.
No, completely. But she did agree that it made sense, the diagnosis, though, from childhood behaviours. She did definitely agree. Yeah. So she was a teacher as well. She's also seen it a few times, but again, in boys.
Yeah, because they would have been diagnosed in the past more commonly.
And uni-wise, I did inform the uni. I had support from the SPLD team. I told lecturers, I'm very open about it. I'll just walk in and go, I've got ADHD, and sit down. So just to clear the air so that you know why I'm being a bit loud. Yeah. But I had loads of support. I also did a DLA assessment, the disability...
Living allowance?
No, not that one. Sorry. The specialist equipment.
Oh, okay.
DSA, that's it.
Yeah.
Disability. We'll move on.
It's fine.
I also did a DSA assessment with, I believe it was Anglia Ruskin University, but many places offer it. And they actually gave me some specialist equipment, including a laptop and a little microphone that records lectures, turns into text for me. I had to contribute a little bit towards it, but they gave me a load of things. They even gave me funding for an ADHD mentor.
Yeah.
And it was amazing. It was really amazing. So I'm just thinking, if I'd never have made that step of getting that diagnosis, I wouldn't have done it.
You would have had all of that. No, not at all. That's interesting. Yeah. And my experience, so you've said about what did I think of you? Because obviously I taught you and stuff. I mainly had you in the third year.
Yeah.
And I don't know if I'd have jumped straight in saying, oh, Sophie's got ADHD, clearly.
Yeah.
Because you were, the main thing I remember is whatever we were doing, you were always really engaged.
Yeah.
Like
yeah.
it didn't actually matter what the topic was or
No.
whatever. It was like, I'm here,
Let's
so I'm
go.
doing it. There was
Yeah.
never a, I'm here and I'm not engaged.
I usually get called inquisitive.
And for the module that we were doing, actually, that was really useful because it was really interactive, and it was the whole point of it was to be engaged in that way. So that worked well.
That's another positive of ADHD. Always eager to learn. Always. Even if you don't mean to be, you are.
Yeah, you can't help but ask that
No.
question.
Yeah.
Yeah. So to round things off, what advice would you give to students who might be starting and have a diagnosis, or not have a diagnosis yet but be thinking this might apply to me? What would you want to know if you were in their position?
So I would want to be informed again about the right to choose, because that's not something that everyone knows about. Obviously, the waiting lists put a lot of people off seeking this diagnosis. Use your right to choose. Get seen to quicker. Absolutely. Another thing is take time to sleep. You might be thinking, I've got this much to do. I'm bouncing here, I'm bouncing there. I've got to go to lectures. I've got to do that. Just make sure you have a bedtime, because I didn't, and it destroyed me the next day. And divide your time as well. So if you're awake 14 hours, 8 hours uni, the rest of the day, do whatever you want, Make sure you specify not tasks at certain times, but just time to do what you want.
Yeah, downtime.
Yeah, exactly. Yeah. So, for example, this morning, I went on a visit for work, and then instead of taking a full break, I take little 5-minute breaks. So in between visits, I found out that my spirit animal is a koala.
There you go.
There you go.
That's what works. So take that time out.
Exactly.
Find out your spirit animal.
Exactly.
Next thing.
And even in placements, if you feel like you just, instead of having one solid break, you want little 5 minutes, just tell them. They'll understand completely.
And that's where that confidence to be open about it is really useful.
Exactly. Don't be ashamed.
Yeah. Because some people are. Or they're worried about it, and they're worried about what the perception of them is going to be.
It's nothing to worry about. You're the life of the party. Honestly, it's brilliant.
There you go. Brilliant. Well, thank you very much for coming in to talk to us about it. I think it's been really useful and really helpful, and hopefully anyone watching will have found some use in this. They might show this video to someone else who they think might be useful, might find it useful. If you have any questions after watching this, then you can add comments on the video. You can contact me directly. We can do follow-up ones if we've got more that we need to answer, any questions or anything like that. Please like the video, share it with people that may also watch it, and keep an eye out for the other videos that we've got, because they may be of use to you as well. Thank you very much. Thank you.
Hit that bell.